Welcome back to my session. Today, our focus is on systems, diseases, and symptoms. The aim of this unit is not to give you medical education, but to make you familiarize with the terminology about the systems, science, and symptoms. Of course, it's not possible to study all human body systems in one session, so we'll be shortly working on a nervous system, respiratory system, urinary system, gynecology, female reproductive system, pregnancy, and childbirth. Before we move on, nervous system, let's quickly revise some basic body organs. It's between the two lungs at the front of your chest. It pumps blood containing new oxygen to every part of your body. Heart. They are sponge-like organs. Every time you breathe, they filter oxygen from the air. Lungs. It's below the lungs. It acts like a filter for the blood. Liver. They are in your lower back. They filter waste products. Kidneys. Food, drink, and oral medications start to be broken down and processed there. Stomach. It absorbs most of the nutrients from what we eat and drink. Intestine. It releases digestive enzymes into the small intestine and hormones that control sugar levels in your blood. Pancreas. It's the largest organ in the body. It stops your body from drying out and is the main barrier against infection. Skin. They protect internal organs. Bones. Nervous system is related to vital body functions, sensation, and body movements. If you look at the pictures on this slide, you see 4 functions of nervous system: hearing, sight, sensation, in other words, feeling, and balance. Let's briefly talk about hearing. What kind of signs and symptoms you may experience when you have a problem with the system? You might have buzzing or ringing in the ear. You experience difficulty understanding words, or you need to turn up the volume of the television or ask others to speak more slowly, clearly, and loudly. And all of these symptoms actually tell you something. You need to have your hearing tested because these signs and symptoms may lead to loss of hearing. In other words, deafness. Sight. You might have minor problems like eye strain. It happens when you overuse your eyes, like reading for hours, working at the computer, or driving long distances, etc. Or you might have a bit more serious symptoms like blurred vision, eye pain, light sensitivity, or double vision. These symptoms may lead to loss of sight, which is blindness. As for sensation and balance, sensory nerve damage may cause symptoms such as pain, sensitivity, numbness, tingling or pins and needles, burning, problems with positional awareness, etc. Okay, when you are unconscious, you are unable to see, move, or feel in the normal way. In other words, you are unaware of what's going on around you. That's loss of consciousness. We can express loss of consciousness as in the examples. He passed out. He had a blackout. He fainted. Or she had a fit. She had a seizure. Or he had an epileptic seizure. Now let's compare the following words as a noun and adjective. Blindness is a noun, blind is an adjective. Consciousness is a noun, and conscious is an adjective. Deafness, deaf. Dizziness, dizzy. Numbness, numb. Unsteadiness, unsteady. Read the dialogue and fill in the blanks with the words given in the box. There are 3 extra words in the box. Okay, what's the difference between sign and symptoms? A symptom is subjective. That means what you feel as a patient, such as low back pain, anxiety, fatigue, etc., only the patient can perceive them. In contrast, a sign is objective. That means it's apparent to the patient, physician, and others, such as blood coming out a nostril. Everybody can see it is bleeding. Now, let's see 3 types of symptom. Remitting means to become less severe, less serious. For example, symptoms of the common cold may last for several days and then you feel better without treatment. That is called a remitting symptom. Chronic symptoms are long-lasting and recurrent symptoms. Recurrent means happening or appearing several times. They are often seen in ongoing, in other words, continuing conditions such as diabetes or cancer, asthma, etc. And relapsing symptoms are the ones that have occurred in the past, resolved, and then returned. For example, symptoms of depression may not occur for years, but can return, and that is called a relapsing symptom. Let's see some expressions to talk about symptoms. Here is an example. Headache. Let's see, the problem is headache. So we need to describe it. Pain is extreme or mild or throbbing, you can say. Pain located means where exactly. On one side of your head, on both sides of your head, or around your eye, etc. Onset means how does it start? Gradual or sudden, etc. Duration of headache is how long does it last? A few hours to days, a few hours to hours, etc. Recurrence of headache means how often does it happen? Daily, gradually becomes more frequent, etc. Triggered by means what makes it worse? Stress, change in sleeping patterns, etc. Accompanied by means other symptoms apart from headache. So, fever, dizziness, seizures, nausea, and vomiting are some examples of accompanying symptoms. Relieved by means what makes it better? Over-the-counter pain medication or lying down in the dark, etc. Now let's practice. Read the text and complete the chart about vertigo. Do not write full sentences. Check your answers. Common symptoms of vertigo: dizziness, a loss of balance or unsteadiness, nausea and vomiting. Severe symptoms: double vision or loss of vision, hearing loss, loss of consciousness, and numbness or tingling, triggered by specific changes in the position of your head when you tip your head up or down, when you lie down, or when you turn over or sit up in the bed. Accompanied by dizziness. Recommendations: use good lighting if you get up at night. Walk with a cane for stability if you are at risk of falling. And finally, physical therapy and home treatments may help. Okay, now let's talk about respiratory system. After studying necessary vocabulary, you will be writing a dialogue using the case notes. As you know, cough is a common symptom of respiratory infection and lung disease. A cough may be productive. What does that mean? If a cough is productive, the patient coughs up phlegm. Phlegm or mucus is the yellowish substance produced in your nose and throat, especially when you have a cold. Also, a cough may be non-productive. That means there is no phlegm or mucus when you cough. Look at the chart. You see the collocations of the word breath. Let's study them. Breath is a noun and breathe is a verb. Take a breath means breathe in. Alex took a deep breath, then jumped into the pool is an example. When you breathe in, you need to breathe out. Breathe in, breathe out. Look at the example sentence. Let your breath out slowly and relax. Hold your breath means not breathe out for a few seconds. How long can you hold your breath underwater? During the examination, a doctor can say, take a deep breath, hold it, and let it out. Get or catch your breath means start breathing normally again. He leaned against a tree until he got his breath back. To be or feel short of breath means unable to breathe easily because you are ill or old, etc. When you feel short of breath, you feel intense tightening in the chest. Extreme temperature, obesity, or things like that can cause shortness of breath. Now let's practice these words. Read the dialogue and fill in the blanks with the words given: blood, take, hold, breathing, short, gave up, cough up, out, catch. Now check your answers. On the right side of the slide, you see a case note. Examine the notes and write a dialogue between the patient and the doctor. Use all the information. Complaint: chest pain. Pain is severe, sharp, and sudden. Triggered by smoking, stress, taking a deep breath. Accompanied by cough with phlegm, shortness of breath, fever, headache. Relieved by rest. Diagnosis: asthma. Treatment: start on medication. Recommendation: lose weight, quick relief inhaler use, stop smoking. Please do not move on before you complete your paragraph, and then you can compare yours with mine. Here is an example dialogue. Now let's learn some vocabulary about urinary system. You know, urinary is the yellowish liquid waste that is released from the body. Urinate is the verb form of the urine. It's formal, but everyday life, pass water or pee is common. Bladder is the organ in the body that holds urine. You can pass water, you can pass blood, or you can pass urine. The loss of bladder control is quite an embarrassing problem that is so sudden and strong, you don't get to the toilet in time. Now let's practice these words in a dialogue. Read the dialogue and then fill in the blanks with the words given in the box. Pass water, flow, depends, blood, bladder, go to the toilet, burning, leaking. Now check your answers. Here is a task for urinary system. This is your assignment. Examine the notes and write a dialogue between the patient and the doctor. The patient's problems are marked. Try to use all the information, ask questions as a doctor, and answer the questions as a patient. Now let's learn a couple of words from gynecology, the female reproductive system. Menstruation, a period, is a common name for menstrual, in other words, monthly period. Discharge, liquid that is sent out. Last period, heavy, that means excessive blood loss. Light, heavy period. Regular, clots, almost solid. Study these words first and then read the dialogue and fill in the blanks. Now check your answers. As for pregnancy and childbirth, let's study the word baby with its collocations. Give birth to a baby. Sue gave birth to a baby boy or a baby girl. Have a baby. She had the baby at home or she had the baby at the hospital. If somebody is expecting a baby, that means she is pregnant. Deliver a baby. Somebody helps a woman to give birth to a baby. Usually midwives deliver the baby. A newborn baby. There is plenty of help and advice for people with newborn babies. A premature baby is the one who is born before the normal time. Her baby is 3 weeks premature. Breastfeed a baby. As you know, mothers breastfeed their babies. Let's see some more words about pregnancy and childbirth. Miscarriage is unintentional end to a pregnancy. That might happen early in the pregnancy. Lots of people experience this kind of pregnancy loss. Look at the example sentence. I had a miscarriage before I gave birth to my daughter. On the other hand, abortion is intentional ending to a pregnancy. Parents might not want the baby for any reason and ends pregnancy. She decided to have an abortion. Here is an example. Stillbirth means the baby is born dead. A woman in the next ward has a stillbirth. And birth defect means something wrong with the baby when it's born. About 11% of babies have birth defects. Here is another assignment for female reproductive system. Examine the notes and write a dialogue between the patient and the doctor. As usual, use all the information in your questions or answers. This is the end of Unit 3. Thank you for your participation.